Hello, and welcome back to another episode of Let's Talk About It. My name is Deidre Luna, and I'm here to educate and advocate on topics that may seem taboo or uncomfortable to bring up. For today's episode, we are talking about eating disorders, specifically in men. I wanted to focus on how this illness affects men because it's something that's not talked about very often. A lot of times men don't feel comfortable to come forward and talk about how they're feeling emotionally or even physically. And it's important that we know that even though we don't hear about it very often, it is happening and it's a real thing. Studies have shown that symptoms in men that have eating disorders compared to women can be different, which means that the diagnostic procedures and the treatment may need to be altered depending on the person's gender. For example, if a woman is severely underweight, we know that part of her recovery may involve gaining weight. Sometimes, for men, their course of treatment may be different because they are overweight or at what seems to be a healthy weight, but their habits aren't healthy. And it's important to remember that just because what the number on the scale says doesn't mean a person is healthy or unhealthy. One way that men struggle with eating disorders that is different than women is with an illness called bigorexia. This specific disorder affects more men than women, and it is defined as an individual's obsession over his or her body being too small or underdeveloped. A lot of times this leads to binge eating, overexercising, and use of steroids. This illness is very common in athletes and bodybuilders. In a study done by the American Journal of Psychiatry, they tested 9,953 patients. Within that group, they found that 2.1% of women suffered from eating disorders, but only 0.3% of men. While this number may seem small, that makes up about 29 men and 209 women. Again, I know that seems small. But when we take a look at the numbers, it showed that more men suffered from partial eating disorders than women, and more women suffered from full symptom eating disorders than men. This isn't surprising. But first, let's go over the difference between full symptom and partial symptom eating disorders. Full syndrome patients with eating disorders meet the diagnostic criteria if they've been suffering from all of the following behavior for 3 months or longer. Binge eating at least twice a week, having weight or shape concerns, feeling a lack of control over what they eat, and having one or more compensatory behavior. Partial syndrome patients meet all but one of the criteria. There's really not a lot of room there between partial and full syndrome patients. This means that while the numbers may seem off, their struggles are very, very similar. This study also found that a person, regardless of gender, is more likely to suffer from psychiatric comorbidity, meaning depression, anxiety, substance abuse, or any other harmful behavior. When someone has an eating disorder, their body begins to break down the muscle that they have in their body to use it for fuel. The most important muscle in the body is the heart, meaning that a person who has an eating disorder is putting their heart at high risk. If the heart is damaged, it will beat slower. Some physicians confuse the slow pulse of a healthy, strong heart in an athlete with the malnourished heart of a person with an eating disorder, making it harder to diagnose, especially in men. Purging depletes electrolytes from the body. Neurons use electrolytes to send signals to the brain and the body. Severe dehydration and electrolyte imbalances can lead to seizures and muscle cramps in ED patients. Anorexia is also the most deadly of eating disorders, and about 25% of men with eating disorders suffer from it. One of the biggest problems with men and eating disorders is that by the time they are in treatment, they are already very, very sick. Their organs have been damaged, they are very underweight, and sometimes irreversible damage has been done to their bodies. This is why we need to talk about it. If men felt more comfortable talking about their emotions, their self-esteem, their self-confidence, then these individuals wouldn't get to a point of irreversible damage due to late detection and late treatment. Between 1999 and 2013, hospitalizations relating to eating disorders in men has increased by 53%, which means that this number is only going up each year. These numbers will keep rising if we don't work to make our world a more comfortable place for men to come forward and talk about how they're really feeling about themselves. Eating disorders are the most fatal psychiatric illness, and while this may seem surprising, these individuals are at higher risk for kidney failure, heart failure, organ failure, starvation, and suicide. More risk factors than any other psychiatric illness. So what can you do to help people around you feel more comfortable talking about their eating disorder? Avoid making comments if someone has lost or gained a lot of weight recently. You know, if they've mentioned to you like, hey, I've been going to the gym, or hey, I've been eating healthier, celebrate that with them. Tell them, wow, that's amazing. I'm so happy that you're feeling better and you feel more confident in yourself. But if you notice that someone is losing an unhealthy amount of weight, don't mention it. Don't comment on it. Ask them how they're doing. Just be them. Ask them to hang out. Support them. But don't bring up their weight. If you think someone might be struggling with an eating disorder, make a point to compliment their personality, their skills, their qualities that they have. Sometimes just this increase in self-esteem in that way can help encourage this person to treat themselves better and be healthier to their body, and it can lessen the amount of harmful, destructive behavior that they do to themselves. What if you know someone that has an eating disorder? Encourage them. If you know their favorite food or their favorite activity to do, invite them to join you. Sometimes just spending time with those people will encourage them to eat or resist unhealthy behaviors. Treat them like any other person. They're not a wounded animal. They're a person in recovery, and they need your support more than anything. Be their friend. Don't bring up their eating. Recovery should be between them and their doctor or their therapist. If they invite you on that journey, then that's great. But if they don't, they just want you as support. So don't bring up their eating. If you yourself are suffering from an eating disorder, here are some things that may help. Wearing clothes that fit your body. Work with it, not against it. Take time to do something nice for yourself. Make dinner, take a nap, go shopping if you have a little extra cash. Get in the habit of acknowledging all the things that your body does for you every day. I know it's hard, but it's important to acknowledge what you can do as a person every day, even just from getting out of bed in the morning. Write a list of things that you do like about yourself. I started doing this a couple months ago, and it's really been awesome for my mental health. It's really helped me to acknowledge the things that I do and the things that I should appreciate myself for more. So I really recommend this one, even if you're not suffering with any sort of disorder. You should definitely try it out. Find someone that you trust and come forward about if you feel you may have a problem with your eating. Maybe even ask that person to attend therapy appointments or doctor's appointments with you, or talk to your parents or friends or family about what's going on. Take care of yourself. People care about you way more than you know, and everyone just wants you to be healthy and happy. Recovery can be a long journey, but you can do it. Thank you for joining me for another episode of Let's Talk About It. I know this is an awkward topic, but that's the point. We are here to create a safe space and welcome new ideas and prevent old stigmas from entering our new day and age. I hope you learned something and you will be more open-minded the next time you hear about this topic. Thanks.